Hello, this is Dr. Sameer Dalwai, developmental behavioral pediatrician from Indian Academy of Pediatrics, and I'm very happy to bring to you behavioral and neurodevelopmental disorders, actually a red flags guidelines on this topic. Let's start with red flags which we need to pick up at any age, any point of time that the child comes to you. And one of the most important things to understand is giving cognizance or importance to a parent who says that something is going wrong with the child, that the child's development is not like her earlier child, or the child is not meeting milestones, or the mother notices something abnormal about the posture, or something difficult about the behavior, or even academics or learning that the parents report to you. I think it's in India, it's not common that parents will come up with a concern like that unless it's really, really there. So if you have a parent giving you a concern, I think we should take it as a red flag. The next important thing that we should look at is the lack of response of the child, the young child, to sound or visual stimuli. The child is not following or tracking people or objects around across the room, or the child is not turning towards sound, especially if the child has limited or poor or meaningless eye contact, is not really looking at the mother or the father meaningfully eye to eye. That's a dangerous red flag as well. And overall, if you find there's a poor interaction of the child with other children or adults, especially the mother and the father around, the child is more or less in his or her own world and not really interacting with adults around them, we need to be worried about it. One major worry is loss of previously acquired skills. The child had acquired some skills and now has lost them. For example, the child was walking independently after some illness or a seizure or after a bout of even diarrhea. Now the child can't walk at all. That's a loss of a previously acquired milestone that needs to be taken as a red flag. At any age as we go on, if you notice any difference between the left and the right side of the body, either in terms of the strength or power or movement or tone, that's a red flag to be referred for. If you find a marked low tone or a hypotonia or a floppy baby, or you find a very high tone or spasticity or stiff and a tense baby, which is impacting the development of the child, and you find some delay in the motor development or in the functional motor skills, that's a red flag as well. At any point, if you find an abnormal head growth, if you find a macrocephaly or a significant microcephaly or an abnormal shape of the head, or of course, if you find distinct dysmorphic features, you need to pick that up as a red flag as well and note the child's development there. Also, it's important to note for any history of developmental delay in the family, ask for consanguinity. These are things which are very important. And any of these things being there on your list amount to red flags at any age that you need to take very significantly. Now, you also see children or parents coming up with complaints of academic underachievement. My child is not doing well in school. My child studies a lot but is not getting good marks. Or my child has behavioral issues in school. These should be also taken as red flag signs. And hence, what are the key questions that you as a pediatrician must ask the parents? You must ask the parents whether the parents have any concern about their child's either development or the child's behavior or the child's learning at any point of time. The child may have come, the parent may have come for just a vaccination visit, but we need to ask them this question. Are they worried or do they have any concerns? And very often just when you ask, the mother might just off the cuff kind of thing say something. Yeah, I think, and then that's where you would be able to pick it up. But please remember that the parents not reporting something or not having concern does not rule out a developmental behavioral problem. You need to ask the parents, what changes have you seen in your child's development since I last saw the child? And if you don't find a significant improvement or increase in the milestones, especially in a younger baby, that must have you a little worried. Then, of course, we can ask about age-specific skills in various developmental domains. We know there's the gross motor domain, fine motor, adaptive, which is self-help, cognitive or academic, and communication, which is both expressive as well as receptive language, social emotional development. These are the various domains of development, and we can ask specific skills at specific age. And of course, we can assess the child, at least the motor skills. We can assess for the tone, we can assess for the power, we can assess for the reflexes, we can look for the dysmorphology. All these things can be easily picked up as part of a developmental surveillance. Even when the mother is speaking with you, the child-parent interaction is extremely important that you can observe and pick up. How is the parent and the child interacting or connecting to each other? Whether there is a warm, caring responsiveness of the parent to the child, and at the same time, the extent to which the child looks to the parent for comfort and support, because remember, he's in a doctor's clinic. So the baby is bound to be a little worried. So is he gravitating his interaction or attention towards a mother from time to time, or he is completely oblivious? At the same time, what is the way the mother is caring for the child? Because all these things can tell you about what's really going on behind your back. Once you identify the presence of risk factors, they need to be directly referred for evaluation, especially if they have any other risk factors which are environmental, social, economic disturbances in the family. If you have a genetic history of something being wrong in the family, a biological problem, as well as social demographic factors, all these need to be taken as risk factors and referred, or at least kept in mind for evaluation. The other risk factors for developmental and behavioral problems include, and this is complete list that all of us as pediatricians know, any perinatal exposures like infections during the perinatal period, alcohol abuse by the mother, smoking by the mother during pregnancy, especially during the prenatal period. Then during the birth, any birth complications during the time of birth, like a prematurity or low birth weight, perinatal infections like herpes simplex virus or the Zika virus, as you know now, medical conditions like lead poisoning, congenital heart disease, epilepsy, genetic conditions like a Down syndrome or a Fragile X syndrome, all of these would be high risk for developmental problems and behavioral issues, and you need to refer these children as well. In fact, even things like adverse childhood or family experiences, like I mentioned, the socioeconomic problems like poverty or problems in the housing or food insecurity, exposure or discrimination or abuse, all these things are very important. And even a child facing abuse and neglect may suffer many problems of development or behavior that may come up later. Parental unemployment, mental health problems like depression, anxiety, substance abuse, these constitute a very big risk for the child's development as well. Parents with limited education or literacy, and no longer only in the West or Western countries, but even in India, you do have an increasing population of teenage pregnancies, or teenage parents that you may have. What are the general developmental guidelines that we must remember as pediatricians? Even if there is no established risk factor or parental concern, what do we need to pay attention to, at least at some parts of the child's life or some time of the child's life? So the three areas or the time period frame that you must look at is the 9-month period, the 18th-month period, and either the 24th or the 30-month visit that the child pays to you. At 9 months, it's very important because you can observe almost everything emerging. You can look at the motor skills development. You can look for the vision and the hearing abilities. You can look at the social nonverbal communication, including whether the child is vocalizing and whether the child has normal gestures. Early communication skills, especially like meaningful eye contact, responding to the name being called, or pointing out in response to the mother asking something, or in response to what the child needs. These may be coming up early. And as we know now, evidence tells us that symptoms of autism, such as lack of meaningful eye contact or response to a name call or pointing meaningfully, they may be absent and may be recognizable in the first year of life itself. So the 9-month visit is very, very important for social communication disorders, as well as for emerging motor developmental disorders. 18 months is important because by this time you would have expected a good social communication and language development to be evident. And if it's not developing normally, 18 months is a good enough time to pick it up. Especially also mild or minor motor delays that were undetected earlier, even in the first year of life, may become more apparent at 18 months, because by then everybody is aware that the child's motor development must have been very, very significantly developed. And if it's not, it's easy to pick that up. 30 months again is a very important time because 2 to 2.5 years is a time that most motor, language, and cognitive delays are identified. And even if it's been missed earlier, this is a time or a period of child's life that you cannot miss that. And in fact, the American Academy of Pediatrics recommends that specifically at 24 months, or that is 2 years to 2.5 years, you must administer or look at autism and must administer what we call as a MCHAT. That's a modified checklist for autism in toddlers. It's a very easy tool. It's available for free online. You can just download it while the parent is in front of you, ask them the questions, click on the mobile, and that gives you the exact score and the risk for autism. Please, it's a request to all my colleague pediatricians to please keep doing this. Moving ahead, children at 4 years, most of the mild minor problems may have been ruled out, but it's quite possible that a mild autism may have escaped detection earlier. You may see attention deficit hyperactivity coming up. You may have missed a mild intellectual disability earlier, and that may be coming on now. And All this impacts the child's readiness for school. So when you assess the child at 4 years, it is for all these things as well as assessing for school readiness and the social emotional well-being of the child. How independent is the child? How does the child relate to the parents? How does the child greet you, speak with you? Family engagement is very important in the child's education. So that itself needs to be noted. And of course, we need to look at how the child is then going to go on towards reading. And is the child, does he have a good sense of rhyming? Does he understand routines? Is there a good understanding relationship between the parents? Does he understand rewards and punishment? All these things are very important going on for school readiness, because now the child is going to be amidst a group of children. It cannot be an individualized care like at home, and hence the parent and the child needs to have developed for this. And of course, we always spoke about the risk factors for developmental problems. And hence, at 4 years, screening provides us the opportunity to know whether the child is ready for school. Because if there is some kind of a learning problem, this is the right time to remedify it or to start some intervention for it. Finally, coming to the child at 5 years, to screen at 5 years an asymptomatic child is very important and must be an annual kind of evaluation henceforth for mental health disorders and even simpler things than that, like attention deficit, hyperactivity, impulsivity, oppositional behavior, defined behavior, anxiety. All these things are coming up at this age, and hence you need to look at them very carefully at 5 years. Of course, additional indications for mental health screening, all of us do know that any psychosocial issues identified for the family, disruptions in the family, which are quite common these days. It could be emotional as well as financial health issues in the family. Poor school performance is often reported in the first couple of years of kindergarten that the child goes through. Behavioral difficulty, hyperactivity, impulsivity, inattention, inconsistent behavior, irregularity at school. All these things are noted by the teachers and may be informed to the parents. And of course, the child has recurrent somatic complaints like a recurrent abdominal pain, especially while going to school. All these things need to be looked into. And if required, you need to help the parents connect to services that can aid the parent or help the parent. In summary, this is like a it's like a tip of an iceberg, if I may say. But it's very important to not miss the tip of the iceberg, because as you know, the huge iceberg, which is really the threat, lies beneath the surface. And if you miss seeing the red flag, you might really miss the entire iceberg, and it might turn out to be a big disaster that hits your ship. And hence we know that if you pick up a developmental or a behavioral problem early, it's easier remedifiable, it's easily intervened, and the outcome is going to be far more superior and better at a much lesser cost and expense for the family and for all of us. And hence, as they say, a stitch in time saves nine. But for that, we must understand that all of us have to be like Sherlock Holmes. We have to have our antennae up, and being suspicious or having the suspicion is the key. Because if you are suspicious, only then will you pick it up. They always say that the eye can see only what the mind knows. So you know in your mind, you're looking for it, your eye will definitely pick it up. And hence, it's better to be careful and err on the side of being careful, even if you are wrong, rather than being negligent and missing a very important clue. I can't tell you the number of children that I still see at 4 years and 5 years with not just issues like autism, which have been missed, but even some things like a hearing impairment, which may be missed, or a partial visual impairment that may have been missed. And of course, autism all the time. And we still have parents to come and tell us that their doctor told them that it's a male child, so the child will speak late, or the child's father spoke late. Very often, the pediatrician doesn't tell them this. It is their own theory, but they always put it on our name. But we must be very careful to make sure that they don't get this wrong message from us, or if they have that wrong message in their mind, we tell them clearly, look, it's nothing like that. It has nothing to do with the father speaking late or it being a male child, so boys speak late. All that is not at all true. If there is any delay, you need to get it evaluated. And hence, even if they go ahead and get evaluated, it turns out to be all right, great. But if it is something wrong, sinister, and you've missed it up, they can come back. And nowadays with the medical legal issues, that's another big challenge by itself. And finally, I like to end by saying that the part between the ears is the most important part of the stethoscope. So it's our clinical acumen, it's our knowledge, it's our awareness, it's our sharpness, watching the child carefully, observing carefully what's going on, and being able to pick it up, asking the right questions. All this is far more important than any equipment or any test or any tool that you may order. And hence, it's very important to observe. It's very important to analyze rationally what you're observing. It's important to ask the questions to the mother and the father. It's important to get the child to do a few simple tests in front of you. And once you suspect something, even if you are not sure that there's something wrong, as long as you're suspecting something is not right, you need to either deal with it yourself, but act. And if you can't do it yourself, you need to refer the child. But very important, don't just have a blanket referral and end the story. It's very important that you refer the child to a developmental behavioral pediatrician, and it's very important that you stay in touch and you monitor what is going on between that child, the child's family, and the person you've referred it to. Because remember, this is eventually your child. Every super specialist looks at the child only with a small focus, and again may miss out so many other things. Every child with a developmental problem, he may have so many other problems. He may have an appendicitis which might get missed. He may have a cardiac problem which might get missed. He may have so many other concerns. Of course, he needs to follow up for vaccinations and the well baby clinic and all the other health issues and infections. It's very important that the pediatrician realize that she or he are the cornerstone of a child's health till the child and the adolescent is 18 years old. So please remember, you need to continue monitoring the child you refer, because eventually it is your child, your concern and your care, and you are the God for the family. And hence, you being involved with the child's family is very important. Speak to the person you have referred to, the developmental pediatrician you have referred to. Make sure that you get daily, or I won't say daily, but make sure that you get regular updates from that person, so you are able to bridge the gap between the specialist and the parent and explain to the parent what's going on. Your word matters the most. This is Dr. Sameer Dalwai from Indian Academy of Pediatrics. Thank you very much.